everyone. So for this lesson, lesson 15, you do have both an assignment and a quiz. The quiz you're going to access via this link here, and this is the instructor view. But I wanted to just point out that you do need to open this document first for the assignment because the clinical information for this particular assignment is not in your textbook. So you're going to have to use this document to get your clinical information. Your first case study is a patient with a vulvar dysplasia. They're doing a partial vulvectomy and vulvar biopsies. Biopsies is pluralized. Again, I would suggest you download the assignment to your computer and that you then open it. You can print it out and work on it offline. You're going to, obviously, it's been passed submission. You're going to provide your codes in the quiz tool. This patient's having this done via an incision, and there's no endoscopic equipment. There's multiple codes for this procedure for the first one. The second one, the patient is having a total abdominal hysterectomy with a bilateral salpingo-oophorectomy. It's identified as an open surgical approach. As in your chapter exercises, your non-assigned exercises, there's more than one code. So please make sure that you're paying attention. You coded the non-graded exercises so that you are fully prepared before you work on the graded assignment. Case number 3 is moving to the male anatomy. Now we have a patient who is having a spermatoceliosectomy and a left orchiectomy. Remember your note, patient is having a procedure on the right side of his body and the left side. Each has a unique root operation. The placement of drains, irrigation of surgical sites, exploration of sites, and histology sampling set to pathology are not separately coded. They are all integral to the main 2 surgical events. And this patient is having stuff or specimens sent to pathology for analysis. It states in the clinical information sent to histology. And then your last one is a patient who has a testicular torsion. You have an example of something similar. It may not be exactly the same, because don't assume that every procedure is going to be coded exactly the same. This patient has a testicular torsion. He's having a detorsion and then a bilateral orchipexy. The word pexy equates to something in terms of your root operation. There's also a notation here at the bottom. This patient is having the relief of a torsion of a testicle, and then his testicles are moved into their correct anatomical position. That equates to what root operation? The torsion relief is not coded separately. So again, make sure you're looking at the information fully. You're also looking at the non-graded exercises. Additionally, when you go to the submission area for lesson 15, you will note that you have 2 submissions. So once you submit it the first time, you will be given information about which collections are incorrect, and you have the opportunity to go back and correct them. Be careful though, because again, if you code a or type a capital O and it should be a 0, it's going to show as being incorrect, and that could be the only thing that's wrong with your selection, with your code. So be careful when you're going back recoding that you are changing what needs to be changed. The highest score is what is used. And the maximum point for this particular assignment is 10. If you have any questions on this, please let me know.